Hi students, I am Dr. M. Ashraf Majrooh, Professor of Community Medicine. I welcome you in the learning session of Occupational Surveillance. This is the fourth session on occupational health. The highlights of this session are the concept and scope of occupational health, occupational surveillance, the strategic approach and the stakeholders, the occupational surveillance methods, the steps in occupational surveillance, and prevention model and intervention for occupational health. So these are the highlights. We will take one by one and discuss in detail. So first of all, the concept of occupational surveillance. The occupational surveillance mean to keep watch over the health and safety of the workers. Specifically, it is defined as ongoing system of data collection, analysis, interpretation, and timely dissemination of information to the stakeholders for prevention of diseases and injuries at workplaces. So the keywords are it is ongoing system and it is the system of collection of data uh, and its analysis, interpretation, and most important is the timely dissemination to the stakeholders. The stakeholders are those persons who have to take the action on the surveillance. So this is the definition, and the occupational surveillance is generally divided into two categories. One is focused on the workers' health, that is the health surveillance, and the other is focused on the workplace safety. This is known as hazard surveillance. So there are two distinct categories of surveillance. One is on the workplace safety, for the workplace safety, and other is focused on the health of the workers. So what is health surveillance? It is pre-placement and periodic medical examinations as well as lab testing of the workers, and it is intended for early detection and prevention of diseases to the workers, health workers. And on the other hand, the systematic monitoring of workplaces for hazardous chemical substances exposures, and it is intended for the purpose of the safety of the workers at workplaces. So this surveillance will ensure the safety of the workplace, and this surveillance will ensure the health of the worker. So this is the concept of the occupational surveillance. Now, health surveillance, we will deal with health surveillance. The objective of health surveillance are early detection of health effects, to reverse and limit the health effects, to stop the further exposure, to use the data of workers' health data for the planning and for hypothesis generation. It is also used to trigger the hazardous surveillance at workplaces. So these are the objectives. Then the assessment methods used for health surveillance are pre-placement medical examination, periodic medical examinations, and a medical examination on reporting, special reporting, and biological screening of the workers, where the laboratory tests are done, and legally mandated medical examination. We will explain one by one all these examination. We will go into the details of each method. Then action and recommendation, the provision of healthcare and treatment, The removal from the exposure is recommended, the job analysis and job substitution, and the recommendation of the recommendation for hazardous surveillance. So these are the actions and the results pertaining to the health surveillance. By using the health surveillance, these action can be recommended. Now, what is hazard surveillance? This is also known as the ambient monitoring, mean the environmental monitoring. The objective of this surveillance are the identification of potentially harmful level of exposure at workplaces to ensure the safety at workstations, administrative control to reduce the injuries and diseases, and it is also to ensure the conformity to the labor laws. There are many labor laws like Occupational Safety and Health Act, and these are ensured through the hazardous surveillance. And then the methodology is the assessment methods are the workers interview, walk-through observations, regulated inspections, mean the inspection carried out under the regulatory bodies, through the regulatory bodies, and environmental sampling for regulated toxic substances. So these are the methods for the hazard surveillance. Then what are the recommendation? The recommendation made on the basis of hazardous surveillance are the substitution of toxic chemical substances, the substitution of the processes, engineering measures, the isolation of processes, isolation of workers, the personal protection equipment, and the implementation of legislation. These are the action based on the hazard surveillance or ambient monitoring. Now we will move forward on the strategic approach and the stakeholders for the surveillance. The strategic approach consists of 4 steps. At first step, there is anticipation of the health stressors, and in second step, we evaluate the health stressors. We quantify the health stressors. Currently, they are there as acting evaluation of health stressors. Then control of health stressors is the third step, and in fourth step, the social protection and health justice is ensured. How the anticipation is done to foresee the health stressors and to identify the potential stressors at workplaces, and the existing exposure to the health stressors is estimated at this step. In second step, the data collection of environmental monitoring and biological monitoring and analysis and interpretation of this data, and then advising the control measure. The control measures include health education and awareness, personal protection technique, equipment implementation, and engineering control and recommendation and communication to the stakeholders. Then legislation implementation in social protections and health justice. Legislation implementation, health insurances, social insurances for the worker, and social security benefit and compensation for the workers. So this is the strategic approach, and this strategic approach is not individual, it is multidisciplinary, and it can be implemented through number of stakeholders. Now I will like to introduce the stakeholders for the health surveillance. The stakeholders have different roles and responsibilities at their levels. So the first stakeholders are the industrial owners who are engaging the workers, and then are the occupational health professionals providing health care at the workplaces. Then employees social security institutions, they are meant for the social protection of the workers. Then workers themselves. So each of out of these four stakeholders, each bears their own responsibilities related to health surveillance. In industrial owners, the use of ergonomic principles, use of safety standards, use of the safe processes like isolation, substitution, and abide the occupational safety and health laws and monitoring of hazards. These are the responsibilities of the industrial owners as stakeholders. What are the responsibilities of healthcare professionals? The responsibility of healthcare professionals are medical screening, biological monitoring, healthcare standards, establishment, and again they have to abide the occupational safety and health laws, and health surveillance is their domain. Uh, so these are the responsibilities of occupational health professionals. Then employees social security institution bear the responsibility of social security insurances, health insurances, and compensation when the workers have lost some losses, compensation for the losses at the workplace. And they have also have to promulgate the occupational health laws, safety and health laws. Then workers, they bear a great responsibility. They must be aware of using the personal protection techniques, equipments, and they must be aware of the risks at the workplaces, and they must show the conducive behavior at workplaces, and they should keep the personal hygiene and prophylactic measures. So these are the roles and responsibilities of various health stakeholders regarding the health surveillance. So why the interestingly how the entrepreneur is compelled to care for the health workers. Generally, they're reluctant and for caring the health workers, but there are certain balances, checks and balances. What are those? Number one is the voluntary accreditations. The industrial owners have to, for the quality standards, they have to get certification from international standard organizations, and these certification include the workers protection and all those laws implementation. And due to these standards, quality standards, they have to maintain, they have to care the health of the workers. Then quality standard marketing competition is also compelling them for the care of the workers, and their repute is also important, repute of the companies. And national and international regulations, there are so many national and international laws promulgated by the government, like in Pakistan, the Industrial Act and the Environmental Act and the Factory Act. All these acts are related to the protection of the health workers. The legislation and enforcement compel the industrial owner to take care of the patients. Then Occupational Safety and Health Act, OSHA, it is basically the United States Act, and similar acts are existing in many countries. Social and civil security pressures are also there through NGOs, labor unions, and national and international labor organizations. They are also compelling the major stakeholder to take care of the health workers through the health surveillance. Then a term used in the health surveillance, they have to be keep into mind. Occupational Safety and Health Administration. This is the institution created by the United States, and it is under the act which is also known as OSHA, Occupational Safety and Health Act. But this organization is known as Occupational Safety and Health Administration. Then OEL, occupational exposure limits, have to be established by a number of organizations and listed on many occupational safety health acts on web pages. The hazardous chemical toxic list of hazardous chemical substances is available for OEL, occupational exposure limit levels. Then PEL, permissible exposure limit, is a term to protect the worker against the health effect of the exposure to hazardous substances. These are the limits. They are also under the regulations. Then TWA, time weighted average of exposure, is measured, quantified, and the ceiling and peak limits for PEL. And maybe the PELs are 8-hour time weighted averages. Although there are also ceiling and peak limits, and many chemical include a skin designation worn against the skin contacts. So these are various terms used in the surveillance procedures. Then occupational surveillance methods. We will deal one by one the occupational surveillance methods. There are two categories I have already defined. The health surveillance include the pre-placement medical examination, the periodic clinical screening, and then the biological monitoring and susceptibility screening, and general health appraisals. These two tests, they are very important. Biological monitoring is done through the laboratory testing, and susceptibility screening is among those people who are susceptible to certain chemicals or genetic susceptibility. So these are the special screenings. They are not generalized, but these three things, they are generalized. The general health appraisal is not usual part of the health surveillance, but for integration of health services, the general health appraisal is also included in some countries. Then hazard surveillance, the mechanical injuries and risk assessment. Then offensive trade and job exposure assessment is carried out in hazard surveillance. The toxic chemical substances, there is a list of toxic chemical substances, which are regulated to be measured at the workplaces. These are the arsenic compound, asbestos and benzene, blood-borne pathogens, cadmium and lead, coke, oven emissions, and ethylene oxide, and noise and radiation. These are the regulated substances and the processes. And then pre-placement examination. And the pre-placement examinations are conducted after the offer of the employment, but before the commencement of the assigned tasks. It may be selective or comprehensive health examinations. And the objectives of the pre-placement examination to guide proper placement of the worker and training needs, to assist the selection and identification of workstations, and to design the personal protection equipment for the workers, especially having the disabilities, to have a baseline health status of the worker who are likely to expose harmful substances linked with the mining and hazardous jobs. So these are the objectives of the pre-placement examination, and it should be remembered that ethically and legally it is for fitting to job, not for exclusion from the employment. This is the misconception, and this is the positively taken medical examination to fit the worker on the job, not to exclude. Then we will move on to the periodic medical examination. The periodic medical examination are regularly conducted on those workers who are regular employee of certain industries, and then and the purpose of this periodic medical examination is early detection and prevention of and treatment of diseases and exposure risks, to provide health education and advice to target groups as well as to all employees. This may be specifically for certain target groups or maybe for all employees, to ensure the legal compliance of occupational safety and health laws. These are the purpose of periodic medical examination. Then the periodic medical examination are conducted through a certain protocols, and that are the worker interviews, either interview or the worker information through the questionnaire. Then detailed clinical examination is conducted in periodic medical examination. Laboratory test and X-ray for pulmonary function test, audiograms, blood and urine and exhaled airs, etc. Depending upon the exposures, the tests are advised. They are variable, and every industry have its own protocol for the laboratory tests. Then duration of these periodic medical examination is usually 12 months, but it is determined by the nature of the job and the risks of the exposure. Certain exposures, like to work in compressed airs, the early examinations are advised that may be 3 months, and sometime when the risks are less, then the duration may be extended to 14 and 15 months. Then some examinations, medical examinations, they are demanded by the statutory bodies, and they are mandated medical examination. they are under the laws, and this is the example. Usually the statutory bodies provide a list of uh, toxic substances where the exposure and the jobs which required the medical examination. For example, and the ionizing radiation, and the radiographers, radiotherapists and luminar workers, they are liable to exposed, and they should be subjected to general medical examination and blood tests, and the duration is regular duration is 14 months. Similarly, for asbestos, the asbestos worker, brake line industries, and other industries dealing with the asbestos, they are required to have the periodic medical examination, that is general medical examination, and X-ray chest for pneumoconiosis is required, and 12 months is the duration. Similarly, silica dust, drillers, borers, concreters and excavators, the general medical examination as well as the X-ray chest and audiometry is also required. Audiometry is required where the noise is there. For example, here audiometry is required, and in welding the audiometry is also required. In welding, the welders are exposed, and the periodic medical examination is 12 months. This is the list. These type of list is continuing, and this is the example how the statutory bodies, they recommend the medical examinations under the laws and regulations. Then examples of screening, like screening test. The example is the lead exposure. The urine and blood is advised, and the substances tested in urine is the copoporphyrin and aminolevulinic acid, and the urine lead level, and in blood the blood lead level and basophilic stippling. These are the screening tests which can be implied, and they are part of the periodic medical examination. Then environmental monitoring or hazard surveillance. In hazard surveillance, it is carried out for detection and quantification of hazardous chemical substances levels at workplaces and in the vicinity of factory areas. So the level may be, if the community is liable to expose, then these tests are also recommended to the community which is living near the factory, the exposure level in the vicinity, and as well as the exposure level within the factory. The sampling and air testing are done to estimate the level of toxic chemical substances like allergens, carcinogens, and infectious agents like bacteria, viruses, fungi. So these sampling is done in the ambient environment. The objectives are the recommendation of action like isolation of the workers, process, or substitution of the workers and process, then mechanization and automation of the processes to protect the workers. So this is the environmental monitoring or hazard surveillance. Now we will move on to the steps in occupational surveillance. The steps in occupational surveillance consist of 4 steps. So first is the forecasting the risk, and then surveillance data, fresh data collection, surveillance through the hazard surveillance and through the health surveillance. Then data analysis and dissemination, and then action through the stakeholders. The actions are taken through various stakeholders, as I have already mentioned the roles and responsibility of the stakeholders. So how the forecasting is done? And the forecasting, the list of diseases on the basis of mortality and morbidity data is prepared on the basis of existing data. Then list of hazardous trade and substances is prepared. Then the notification problem, local and international level. Certain diseases and substances, they are internationally liable to be monitored. Then they are included in the surveillance list. So first the priority list through forecasting risk is prepared. Then the examination, as already mentioned, pre-placement and periodic medical examination, biological monitoring through health surveillance and hazard surveillance monitoring, the environmental monitoring and suspect surveillance. Then data is used for quantification of the diseases, quantification of hazards, gap analysis in safety standards, gap analysis of environmental stresses, gap analysis of occupational safety and health acts implementation. So these are the information generated through this surveillance data. Then the actions, advocacy of entrepreneur and the policymakers on the base of the evidence generated through the surveillance. Then personal protection equipment and health educations, awareness of the workers, then recommendation for employee social security institutions. So these are the four steps in occupational surveillance. Then the countries, they are preparing their top 10 disease list. That top 10 diseases, they are placed on the surveillance list. And the National Institute of Occupational Safety and Health of United States have prepared their own top 10 diseases list. Like they have included the occupational lung diseases, the pneumoconiosis and allergies, sensitivity syndrome, lung sensitivity syndromes. They are associated asthma-like conditions associated with the included in the occupational lung diseases list. Then musculoskeletal disorders, they are very important to be included. They are causing the localized and generalized fatigue to the body. Then occupational cancers, as the workers are exposed to toxic chemical substances, hence they are liable to develop the cancers of the liver, skin, and other deep-seated organs are there, and there are so many carcinogens in the environment and at workplace. Then severe occupational accidents, they are included in the list, as they are preventable through the ergonomics. The cardiovascular diseases, they are associated at workplaces, and they are due to the toxic chemical substances. Reproductive disorder are also associated. Similarly, neurotic disorders. Noise-induced hearing loss may occur when the exposure is exceeding 85 decibel, 8-hour exposure. And the dermatological disorders are associated with the irritant and toxic chemical substances. Then the pressures to the health stressor, mental health stressors are acting, they are at the number 10. So this is the top 10. Similar list, every country have their own priority list for surveillance. Then a prevention model and intervention. The prevention model is a behavioral model for the prevention is used for occupational health. It consists of three main strategic areas is the health promotion, health protection and health prevention. This is the self-domain mean informed choices and this is the worker domain mainly and then is the health protection. It is the compulsions and enforced actions and the actions they are compelled through the legislations and these are the responsibility health prevention. These are the actions of the health professionals to be taken. So, what is this health promotion? It is the voluntary choices and behavioral change intervention. It includes the advocacy of the stakeholders, evidence-based advocacy, and awareness of the worker for the informed choices to have the conducive behavior at workplaces. Workplace health education and personal protection equipment use is the domain of this. Then the enforcement actions, it is also known as health protection, the occupational legislation through labor laws and social security insurances. And then medical measures are the health professional domain is known as health prevention, the screening and treatment, periodic medical examination, then immunization and permissible exposure levels and time weighted average of permissible levels. Then physical work capacity quantification and biomechanics, use of biomechanics. These are the domains of the health preventions. So this model is used. Based on this model, and the various intervention like job analysis is done. The job analysis is done in various categories. They include the worker fitness to the job. This analysis is for fitting the worker to the job, and then psychological analysis for the psychological support of the workers, then ergonomic analysis for fitting the workers to the machine. So these are the analysis, various analysis done, job analysis. Then objectives of the job analysis are the job substitutions. If a person is not fitting to one job, then the job is substituted through the work through the job analysis. Then machine alteration and substitution through ergonomic techniques. Especially this is for the disabled persons. They have to develop the special workstations through job analysis. Job rehabilitation is when the psychological analysis, job analysis is done, then the job rehabilitation is done. So this is very important intervention in health surveillance. Then usual set of personal protection equipment like helmet, dust mask, safety boots, protective gloves, wristcloth, and protective eyewears. Then lastly, the action on the worker-employer relationship. This is very important area of health surveillance actions. These are the occupational legislation and labor laws, local and international laws implementation. Then employee social security acts They are very important for the safeguard of income and salaries, fixing the minimum salaries of the workers and fixing the compensations, service conditions, and then degree of responsibilities for these financial responsibilities, the health insurances and protections, compensation of the body losses, and life insurances. All these are the action recommended through the health surveillance, occupational surveillance. Then lastly, the summary steps for the surveillance program. The exposure assessment for most likely adverse health effects, selection of medical tests based on evaluation, identification of employees to be tested and testing frequency, analysis and interpretation of individual and group test results. The action based on the results may be verification of the test results, sharing of the reports to the employees and the employer with confidentiality, additional tests for further diagnosis and treatment, exposure evaluation and reduction of hazardous exposure, and then maintenance of the record, and lastly the evaluation for um, adequate quality control. So this is the summary of the summary steps for the health surveillance program. Lastly, I should recommend the readings. This lecture is from the book of Public Health Maxi Rose and Wallace Maxi, and I have also consulted the web literature, but mainly this lecture is based on the Wallace Maxi 13th edition. Uh, Thank you very much.